Paraphilic disorders represent a complex category of mental health conditions characterized by recurrent and intense sexual arousal patterns involving atypical objects, situations, fantasies, or behaviors. These disorders have been extensively studied within the field of psychology and psychiatry, forming a crucial component of human sexuality research and clinical practice. The understanding of paraphilic disorders has evolved significantly over the decades, reflecting changing societal attitudes, advancing scientific knowledge, and refined diagnostic criteria that distinguish between consensual adult behaviors and pathological conditions requiring clinical intervention. The diagnostic framework for paraphilic disorders, as outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, establishes clear criteria that differentiate between paraphilias and paraphilic disorders. A paraphilia refers to any intense and persistent sexual interest other than sexual interest in genital stimulation or preparatory fondling with phenotypically normal, physically mature, consenting human partners. However, a paraphilic disorder emerges when these interests cause clinically significant distress or impairment in social, occupational, or other important areas of functioning, or when they involve non-consenting individuals. This distinction is fundamental to understanding the clinical significance and treatment implications of these conditions. The etiology of paraphilic disorders remains multifaceted and incompletely understood, involving complex interactions between biological, psychological, and social factors. Research suggests that neurobiological mechanisms may play a role, with studies indicating potential differences in brain structure and function among individuals with certain paraphilic disorders. Hormonal influences, particularly testosterone levels and their fluctuations, have been implicated in the development and maintenance of these conditions. Additionally, developmental factors including early childhood experiences, trauma history, and attachment patterns may contribute to the emergence of paraphilic interests. The interaction between genetic predisposition and environmental triggers continues to be an active area of investigation, with researchers exploring how various risk factors combine to influence the development of these disorders. Clinical presentation of paraphilic disorders varies considerably depending on the specific type and severity of the condition. Common paraphilic disorders include exhibitionism, which involves exposure of genitals to unsuspecting strangers, voyeurism, characterized by observing unsuspecting individuals who are naked, disrobing, or engaged in sexual activity, frauderism, involving touching or rubbing against a non-consenting person, and pedophilia, which involves sexual attraction to prepubescent children. Other recognized paraphilic disorders include sexual masochism disorder, sexual sadism disorder, transvestic disorder, and fetishistic disorder. Each of these conditions presents unique challenges for both the individuals experiencing them and the healthcare professionals providing treatment. The assessment and diagnosis of paraphilic disorders require careful clinical evaluation conducted by qualified mental health professionals. Clinicians must distinguish between consensual adult sexual behaviors, which may be unconventional but not pathological, and genuine paraphilic disorders that meet diagnostic criteria. The assessment process typically involves comprehensive clinical interviews, standardized assessment tools, and careful consideration of the individual's history, current functioning, and level of distress. Differential diagnosis is crucial, as paraphilic disorders may co-occur with other mental health conditions such as mood disorders, anxiety disorders, substance use disorders, or personality disorders. Treatment approaches for paraphilic disorders are diverse and must be tailored to the specific needs of each individual. Cognitive behavioral therapy, CBT, represents one of the most widely used and evidence-based treatment modalities. CBT focuses on identifying and modifying dysfunctional thought patterns, developing coping strategies, and promoting behavioral change. Acceptance and commitment therapy, ACT, has also shown promise in helping individuals accept their experiences while committing to value-based actions. Psychodynamic therapy may be beneficial for exploring underlying psychological conflicts and early experiences that contribute to the development of paraphilic interests. Pharmacological interventions may be considered in certain cases, particularly when paraphilic disorders involve high risk of harm to others or significant distress to the individual. Selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed to help reduce sexual preoccupation and compulsive behaviors. In more severe cases, anti-androgen medications may be used to reduce testosterone levels and associated sexual drive. However, medication should always be combined with psychotherapy and used only under careful medical supervision with informed consent. The management of paraphilic disorders extends beyond individual treatment to include broader considerations of public safety, legal implications, and ethical concerns. When paraphilic disorders involve illegal behaviors or pose risks to others, treatment providers must navigate complex issues related to confidentiality, mandatory reporting, and collaboration with legal systems. The development of specialized treatment programs within correctional settings and community-based interventions reflects the importance of addressing these disorders within a comprehensive framework that considers both individual rehabilitation and public safety. Prevention strategies for paraphilic disorders focus primarily on early identification and intervention. Educational programs that promote healthy sexual development, trauma-informed care approaches, and early intervention services for at-risk individuals may help prevent the development of paraphilic disorders. Community-based prevention efforts also emphasize the importance of creating supportive environments that facilitate help-seeking behaviors and reduce stigma associated with seeking treatment for sexual concerns. The prognosis for individuals with paraphilic disorders varies significantly depending on multiple factors, including the specific type of disorder, severity of symptoms, presence of co-occurring conditions, treatment engagement, and social support systems. Some individuals may experience significant improvement with appropriate treatment, while others may require long-term management and ongoing support. The motivation for treatment, willingness to engage in therapeutic processes, and commitment to behavioral change are crucial factors that influence treatment outcomes. Research in the field of paraphilic disorders continues to evolve, with ongoing studies examining neurobiological mechanisms, treatment efficacy, and prevention strategies. Advances in neuroimaging technology have provided new insights into brain structure and function in individuals with paraphilic disorders. Additionally, research on the effectiveness of various therapeutic approaches continues to inform evidence-based practice guidelines and treatment protocols. The social and cultural context surrounding paraphilic disorders significantly influences how these conditions are understood, diagnosed, and treated. Cultural attitudes towards sexuality, gender roles, and acceptable sexual behaviors vary across societies and historical periods, impacting the conceptualization of what constitutes pathological sexual behavior. Healthcare providers must be sensitive to cultural factors while maintaining focus on clinical criteria and evidence-based treatment approaches. In conclusion, paraphilic disorders represent a complex and challenging area of mental health that requires specialized knowledge, skilled clinical assessment, and comprehensive treatment approaches. The ongoing evolution of diagnostic criteria, treatment modalities, and prevention strategies reflects the commitment of the mental health community to better understand and address these conditions. Through continued research, education, and clinical innovation, the field continues to advance toward more effective interventions that promote individual well-being while addressing broader societal concerns related to sexual behavior and public safety.